ALS is amyotrophic lateral sclerosis. Okay? It is a progressive neuromuscular disease. Right? It's actually a disease of the brain, even though it looks like a disease of the muscle. Okay? It affects the muscles, and it can present in various ways. Right? So it can present via the limbs, okay, where somebody's extremities become weak, okay, and they can still speak and they can still swallow and they're still breathing, okay. And then it can present what's called bulbar, which is speech and swallow. So sometimes people might sound like they're drunk, like they're slurring their speech, right? And you may need to listen very attentively, right? And listen slowly, right? And the thing to remember with that is that they're not hard of hearing. So that happens often, and I've even been guilty of that, that you hear someone speaking differently, and then I start speaking more loudly, okay? So it's not that they're hard of hearing, okay? Their speech is affected, okay? So that's bulbar onset, okay? So that involves the speech, the swallow, okay? There can be excess saliva, so they can have drooling, okay? And then that can also involve breathing, okay? There's another onset which is rarer, which is just respiratory, okay? So somebody can be walking around, yet they're really having a hard time breathing. And that incredibly limits their energy levels and affects all of their activities of daily living because they're expending so much energy breathing, okay? Now, the other important thing to know is from time of onset, life expectancy statistically is 2 to 5 years. Okay, so we don't know where you're coming into play along this continuum, right? So there may be several things that you may be seeing from kind of a physical medical standpoint that can be somewhat different and maybe alarming for you, unsettling in some way, okay? So this is where the communicating with your person living with ALS, and if they have loved ones or anyone else, asking questions, and asking them what they need. And if you have a question about their swallow or whatever it may be, asking them, different ways of doing things safely, because their medical team will be guiding them, okay? So ALS, the most common piece that takes any of our ALS people out of this world is respiratory, is their breathing, okay? So, all along the continuum, our people with ALS will have various different equipment in the house. They're gonna have equipment for mobility. They'll have walkers, they'll have, transfer boards, they'll have wheelchairs, they'll have power wheelchairs. They might have wheelchair vans, right? And then they'll also have potentially, if somebody has lost their ability to swallow safely, they may have a feeding tube, right? Which is a tube that goes into their stomach so they can get liquid nutrition through that. Or maybe that's how you may be giving them their medications and their hydration, okay? So then they're going to have potentially a number of equipment and devices, equipment pieces and devices for breathing and for respiratory. They may have a nebulizer machine. They may have, which was something that a lot of people use for asthma. They may have what's called a BiPAP machine, which is similar to a CPAP machine, and that's a machine to really help their lungs and their diaphragm breathe better. They may have a suction machine, okay? If somebody has a lot of saliva, and excess saliva, and if they have drooling, and if they have, thick mucus or something like that, which, I can imagine may sound a little bit unsettling. These are all manageable, right, with education. These are all manageable with education. People live at home with all of these devices for years, all the time, okay? They've been doing this for years, so it is safe with education. It is safe. And there are people as well, medical people, that can come into the house at times and help. And so there are resources, right, to help you feel that you're able to manage all of these things, right? And then there may be patients that also have opted to have what's called a tracheotomy to help them breathe, right? So as their diaphragm has become weakened to the point where it's no longer inhaling and exhaling their lungs, they may need assistance in mechanical ventilation, right? So there could be, there could be a patient that also has a tracheotomy, and it's a tube and it connects to a machine, a ventilator that helps them breathe. So it's easy for me to say because I've seen them for 17 years, right? So for multiple years. But for someone that, if you are new going into someone's house with ALS, some of these things can be shocking. We as professionals, of course, we try to be mindful of our, visual responses, our faces when we walk in, helping to instill confidence in those that we take care of, right? That when I walk in and I'm here to take care of you, even though I'm asking questions and I don't necessarily know how to move your foot the way you like it, or I don't know necessarily how you like to be fed or what utensil you use for this, they're okay questions to ask. But my job as the healthcare professionals to walk in and to hopefully instill some confidence that, you know what, we're going to figure this out together. You're the driver of the train, my person that has ALS, and I'm here to support you as best I can, right? And that we work together.